let's look at the cardiovascular system. One of the easiest ways to do this is to look at what we call the circle diagram. When you look at the picture in your book of the heart, it has 4 chambers: right ventricle, left ventricle, right atrium, and left atrium. What I'm going to do with this is pull them apart and show in an expanded view. If you've seen in your PowerPoint, if you've done your reading, you've looked at that PowerPoint slide, the PDF file, and also looked at the circle diagram there, this will help explain that to you. So first of all, let's draw our 4 chambers. Draw 2 large rectangles and then divide them in half. So let's go left atrium, left ventricle, right atrium, and right ventricle. What I will do is use more of a reddish color for oxygenated blood and a bluish color for a lower oxygenated blood, or what we call deoxygenated. You never lose all the oxygen out of the blood. You don't use it all. So some of it does come back around. It's just at a lower concentration. When we get to the lungs, you'll actually talk about getting oxygen into the bloodstream. Let's start with the left ventricle. That's where we'll start everything. So we'll put an X there. We want to get blood out to what we call the systemic side. When I say systemic side, I mean if you want to get blood to any tissue. So if you want to get blood to the heart tissue, muscle tissue, lung tissue, the brain, anywhere, it has to go through this systemic side. So with this, let's come down. Just draw the squigglies, and let's start it here. So we leave, we call the aortic valve. Some texts may say aortic semilunar valve. Same thing. So blood leaves the aortic valve and travels through arteries. Then it gets to what we call arterioles, which take from artery to capillaries, the squigglies to capillaries. And in the capillaries, the oxygen will go out into whatever tissue, and then we'll pick back up carbon dioxide. So we lose that oxygen content. When we lose the oxygen content, then venules take it back to the vein and bring it into the right atrium. Once it goes into the right atrium, it filters through here, what we call the tricuspid valve. Tricuspid valve into the right ventricle. The 2 ventricles contract at the same time, so it's going to push blood out into the systemic side, and it's also going to push blood out into what we call the pulmonic side. So it travels out the pulmonic valve, or pulmonic semilunar valve, and travels to the arterioles and capillaries that go very close to the lungs. Here, it picks up oxygen, brings it back to the left atrium, through what we call the bicuspid, or mitral valve, that's a D there on the end, through that valve, back into where we started, in the left ventricle. One of the interesting things is arteries carry blood away from the heart. Veins bring it back. So when you want to look at things, think of it, let me get my pointer here. We start in the left ventricle, we go through the aortic valve, then we go to the aortic artery. That's oxygen, highly oxygenated blood. We go to the arterioles and capillaries of whatever tissue it's going to. We lose a lot of the oxygen, and then we go from the capillaries, venules bring it back to the vein, and we come back in the vein into the right atrium. So the vein brings it back. It goes through the tricuspid valve separates the right atrium from the right ventricle. The right ventricle fills. When the heart contracts, it pumps it out on the pulmonic side. Remember, arteries carry blood away from the heart. So here we have a pulmonic artery carrying blood away from the heart. It's low oxygenated blood, what we call deoxygenated. It's the only artery that carries low or deoxygenated blood, or that should carry it. Then it goes arterioles, capillaries, venules. So the capillaries kind of go around. So if you think of my hand as a alveoli in a lung, the capillaries go around it, pick up the oxygen, and then you get a venule, and you get a pulmonic vein with highly oxygenated blood. So that's the only vein that has highly oxygenated blood, brings it back to the left atrium, goes to the bicuspid valve, to the left ventricle, and then ready to go back out again. It's a continual circle. It's very important to get this down so that you realize that oxygenated blood goes out the systemic side. If you want to get oxygen to the lung tissue, it's systemic. If you're oxygenating blood, you're getting oxygen back into the bloodstream, it's on the pulmonic side, and that's the only thing the pulmonic side does, is that it picks up blood from the lungs, but doesn't actually go into the lungs. Remember, oxygen will diffuse across the membranes. So it will go from lung tissue. So if you have, say it's oxygenated, you have lung tissue, and then you have a capillary running very close. Oxygen will diffuse into the capillary. O2 will go in. CO2, carbon dioxide, will go out into the lungs. We'll come back to that when we get to lungs. But systemic side is what gets oxygen to the tissues. Review this a couple times, draw it out, label it, write it out, say it out loud when you're drawing it. It helps to talk through it. Get this down because it makes a big difference for the cardiovascular system.